There's a letter that's going to show up in mailboxes across the country this September. Plain envelope, boring government font. Most people are going to open it, feel a jolt of panic, and either ignore it or make a rushed decision they'll regret in March. That letter says, your Medicare Advantage plan is being canceled. And here's the part almost nobody explains to you. That letter isn't just bad news. For a lot of people, it's the single best opportunity they've had with their healthcare coverage in years. And most of them are going to throw it away without even realizing it existed. I'm going to show you why these cancellations are happening by the hundreds of thousands right now, what most people get wrong when they panic, and the one option hiding inside this bad news that insurance companies have zero incentive to tell you about. Stick around, because option 3 is the one that actually matters here. Let's clear something up first. Getting this letter doesn't mean you did anything wrong. It doesn't mean your health changed. It means your insurance company lost a bet, and you were sitting at the table when they lost it. Here's the bet. Every single year, private insurance companies go to the federal government and basically say, give us the Medicare Advantage members in this county, and we'll cover their hospital stays, doctor visits, prescriptions, dental, vision, all of it, for a set amount of money per person. Think of it like a sealed bid auction, where nobody can see anyone else's number. Each insurance company writes down what they think it'll cost to cover you for the year, builds a plan around that number, your copays, your deductible, your gym membership perk, your grocery card, and then locks it in. They don't get to renegotiate mid-year if they guessed wrong. If more people on that plan get sick than they expected, or costs run hotter than projected, that company eats the loss, every dollar of it. So multiply that across a whole state, a whole year, tens of thousands of members, and some years, some plans, that bet just doesn't pay off. When that happens, insurance companies have exactly one clean exit. Because these are annual contracts, they can walk away from that specific plan when the year ends and simply not renew it. That's not a scandal. That's not a conspiracy. That's a company folding a losing hand instead of doubling down. Here's what surprises people the most. This isn't some once-in-a-blue-moon event. It happens every single fall, like clockwork, the same way certain retailers always run inventory clearance in January. This year, one of the country's largest insurers is walking away from plans covering roughly 600,000 members. Last year, a different major insurer did almost the exact same thing also, around 600,000 people, also roughly the same slice of their total Advantage membership. The year before that, over 1 million people got this letter. Add it up, and you're looking at north of 1 million Americans a year, every year, getting canceled out of their Medicare Advantage plan. Out of the tens of millions of people on Advantage plans nationwide, this is a small percentage. But a small percentage of a massive pool is still a massive number of actual human beings opening actual letters in actual mailboxes. So if this is you or your parent or the client sitting across from you, you are not the exception. You're one of over 1 million people this cycle who are about to face the exact same fork in the road. Here's where most content on this topic gets it wrong. Most explainers hand you a checklist and move on. I want you to picture this differently as 3 doors, because that's genuinely what this decision feels like once your plan is canceled. Door 1 is the door everyone assumes is the only door. Pick a new Medicare Advantage plan. Stay with your old insurer if they've got another option, or shop a new one entirely. Door 2 is the door people walk through by accident by doing nothing. And I want to be blunt about this one, because it's the one that actually scares me. If you don't act, you get dropped back onto original Medicare with nothing else. No drug coverage, no cap on what a hospital stay could cost you. Nothing filling the gaps. This is the door with no floor. Door 3 is the one this video is really about, because it only exists, it only unlocks, because your plan got canceled in the first place. And it's the one almost nobody talks you through. Here's the mechanic almost nobody explains well. Normally, if you're on a Medicare Advantage plan and you decide 2 years in, 3 years in, 10 years in that you'd rather have a Medicare supplement plan instead, you're not just allowed to switch freely. The supplement insurance company gets to ask you health questions. They can look at your medical history and say no or say yes, but charge you more. That's called medical underwriting, and it's the wall that keeps a lot of people stuck on Advantage plans, even when their health has changed, and a supplement plan would genuinely serve them better. But when your insurance company cancels your plan out from under you, not because of anything you did, federal rules flip a switch most people never knew existed. It's called a guaranteed issue right. For a limited window, You can apply for a Medicare supplement plan, and the insurance company cannot deny you, cannot charge you more because of a health condition, cannot ask you a single medical question. That wall just isn't there. Think about what that actually means. Somebody who developed a health condition on their Advantage plan, the exact kind of person who'd normally get turned away or priced out of a supplement plan, just got handed a key that bypasses all of that because their plan got canceled. That's the part that should stop you mid-scroll. The bad news is the mechanism that creates the good news. But in this matters, this door has rules bolted to it. You only get to use this right to go back to original Medicare plus a supplement plan. You cannot use it to hop from one Advantage plan into a different Advantage plan. That's not how the rule works. And you don't get to pick any supplement plan on the shelf. If you became eligible for Medicare before January 1st, 2020, your guaranteed options are typically Plan C or Plan F. If you became eligible on or after that date, your guaranteed options are Plans A, B, D, or G. Some insurance companies will voluntarily let you choose from more than that, but they're not required to, and plenty won't. Now, about the deadline, because this is where people talk themselves into panic they don't need. Medicare's open enrollment window everyone talks about runs October 15th through December 7th, and most people assume that's their hard stop. It isn't not for you, not in this situation. Because your current plan is contractually covering you all the way through December 31st. Your window to lock in a supplement plan under this guaranteed issue right actually runs through the end of December, or up to 63 days after your old coverage ends, which lands you somewhere around March. Picture two people getting the same cancellation letter. One sees December 7th everywhere online, panics, and rushes into the first plan a call center reads off to them. The other knows they actually have until December 31st, an extra 3+ weeks nobody told them about, to actually compare their options and make a decision they won't regret. Same letter, wildly different outcomes. I wouldn't push it past January 1st, though go past that and you risk a gap where you're either uninsured for extras or sitting on original Medicare alone for a stretch. But you have more room to breathe than the loudest headlines make it sound like. One more date to circle. Keep an eye out for a notice from your plan, usually arriving in September, that spells out the change. And know that by law, nobody can walk you through next year's specific plans before October 1st, or actually enroll you before October 15th. So if you're feeling anxious in August, that anxiety doesn't have anywhere useful to go yet. Write the date down and revisit it in October. Now here's the uncomfortable part, and I'd rather you hear it from me than get blindsided by it. Helping someone use this guaranteed issue right takes real work, paperwork, timing, coordination between old coverage and new. In a majority of states, roughly half the country, insurance companies are not required to pay an agent anything for doing that work with someone who isn't already their client. Think about what that does to incentive structures. During the busiest 6 weeks of the entire year, for anyone in this industry, an agent has to choose between serving existing clients who they're compensated to help or taking on a brand new person, doing hours of work, and getting paid nothing for it. Most agencies simply can't run a business that way. I'm not telling you this to make you distrust every agent you talk to. I'm telling you because if you call around in one of those states and get turned away, or you notice an agent steering hard toward an Advantage plan and going quiet the moment you bring up a supplement plan, now you know why that might be happening. It doesn't mean every agent doing that is acting in bad faith. Some people genuinely are better served by another Advantage plan. But if you can afford a supplement plan, you're eligible for one, and an agent won't even discuss it with you. That's worth being cautious about. If you're already someone's client, most good agents will tell you this doesn't change anything. They'll still walk you through it. If you're not, and you're in one of the states where this compensation gap exists, that's a harder conversation, and one worth having honestly with whoever you're talking to. So if that letter shows up in your mailbox or your parents' or a client's, I don't want your first reaction to be panic. I want it to be, which of the 3 doors am I actually standing in front of? Because door 2, doing nothing, is the only one of the 3 that can actually hurt you. Doors 1 and 3 both leave you covered. One of them just happens to come with a key that only exists because of this specific situation.